Hello, Thrive Nation. I've got a very unique guest. He's the author of this incredible book, and I've been using it for at least, I think, 5 years. I think in 2016, the Allergy Solution, written by Dr. Leo Galland, has been just my go-to allergy book. And Dr. Galland, you've affected only my family, as well as all my patients, the thousands of patients that I've seen, as well as the Made to Thrive community. It's been sort of my encyclopedia and Bible on allergies. So welcome to the show, Dr. Galland.
Well, thank you. It's really a pleasure to be speaking with you.
Great. Now, Dr. Galland, you're a Harvard graduate and NYU School of Medicine graduate, as well as board certified in internal medicine. And you've written so many, your website, drgalland.com, is just a resource of research and science and articles and recommendations. And you're a real doctor in terms of the words of teacher. You know, the root of doctor is docere, which means teacher. So very grateful for your time to come on the show and teach us about allergies and the immune system. I do want to grab people's attention that are going to be watching this on YouTube or listening on the podcast, is that there are so many symptoms that people suffer that are actually allergic symptoms, but they're unaware that they're actually due to allergic reactions like weight gain, fatigue, brain fog, ADHD, joint pain, headaches. These are symptoms that people don't attribute to allergic reactions or immune system that's either deficient or that has excess sort of functioning that it shouldn't have. Why do people, or why are they not aware that these allergic reactions can cause these myriad of symptoms, which your book clearly outlines? People are unaware of that. Why is that the case, Dr. Galland?
Well, allergy is a very complex phenomenon. And in terms of Western medicine, the concept of allergy has become very narrowly defined and limited. What the term allergy, actually, which was coined in the early 20th century, at the start of this rolling pandemic that we've experienced, the term allergy means altered reactivity. And that's a very broad concept. Now, during the course of the 20th century, it became clear that what the set of problems that were being referred to under the term allergy involved the immune system. So the immune system mediated allergic reactions. But there's one type of immune-mediated allergic reaction that came to be viewed as allergy, and all of the other immune system-mediated hypersensitivity reactions were not thought of as allergy. And there are actually dozens of types of reactions. There are four main categories, and it's only type 1 that is thought of as allergic. And type 1 involves the production of a type of antibody. Antibodies are proteins made by your immune system. And these are antibodies called IgE antibodies that create reactions that are anaphylactic, but they're also involved in typical pollen allergy reactions, in hives, so everybody just thinks about what can IgE mediated allergy cause, and it can cause a runny nose, it can cause asthma, it can cause skin rashes, and so that's been why the focus has been so narrow. But and as I describe in the Allergy Solution, there is very good scientific documentation for the role of the other types of immune-mediated allergic reactions in producing a wide range of symptoms involving basically every part of the body, every organ system, from inside to out, from top to bottom.
Now, did you write this book because that's sort of not common medical knowledge, that you can have an allergic reaction and cause so many symptoms like weight gain and cognitive issues, as well as, irritable bowel syndromes, from gut issues to changing the microbiome? I mean, these are all possible, either deficiency in your immune system or excesses in your immune system. Is that why you wrote the book?
Yeah, yes, I wrote it because there's a real need for people to understand the great diversity of allergic problems and also what to do about them. It wasn't, I've been treating patients with allergic illness in different manifestations for several decades. And my understanding has broadened and deepened over the years. And one of the things that's become really clear to me is that there is a reason why we're seeing these epidemics of allergies. And there actually have been 3 waves to the allergy pandemic, starting in the late 19th, early 20th century. The main causative factor for the first wave was outdoor pollution. And to some extent, it was industrial pollution. But once automobiles became part of the lifestyle throughout the world, automotive air pollution is a major factor contributing to seasonal allergic disease and to pollen allergies in particular. And what's been studied, and most of the studies, of course, have been done in the Northern Hemisphere and most of them in Europe. Yeah. But what has been demonstrated is that automotive pollution not only is damaging to our own tissues, but it also alters the pollens. And it makes a lot of plants pollinate more.
Okay.
And it also makes the pollen from those plants more allergenic.
Sure.
So it changes us, but it changes our environments in such a way that it's not only our changes, it's the changes in the environment. Now, in about the middle of the 20th century, there was this second epidemic that started, or the second phase of the pandemic, which was involved asthma, eczema in particular. And those started to really take off and become global. And the main factor driving that has been indoor air pollution, because beginning sometime during the middle of the 20th century, people just began spending more time indoors. Television was a big factor for that, just changing lifestyles. But the indoor environment began to change. A lot of this research has been done in Australia, actually. And formaldehyde is a major factor contributing to that, because it's present in so many indoor environments. It especially impacts children, but it will affect adults as well. And so that not only altered the way that our respiratory tracts and skin, our surfaces, function, because formaldehyde is very toxic to the body surfaces inside and out, but it itself is a major allergen and a major promoter of allergy. And it actually alters some of the things like dust that we're exposed to indoors. And at the same time, there were dietary changes that started to occur because of the excessive processing of food and the removal of a lot of natural ingredients that have anti-allergic effects. A lot of these from plants, they're called polyphenols. And the bioflavonoids are probably the main anti-allergic factor in the diet. So we have a situation starting maybe 70 to 50 years ago, in which our diets are changing, our indoor environments are changing. We're spending more time indoors than outdoors. I mean, in the US, people spend about 90% of their time indoors now. And then the third wave of this pandemic started to occur towards the end of the 20th century into the present 21st century. And that's the pandemic of food allergy. In the US, for example, the incidence of tree nut allergy, and that is an IgE-mediated, well-recognized allergy, tripled between the mid-1990s and about 2005. And the changes there have to do with an internal pollution. That is, alterations in the microbes living in our bodies, in the respiratory tract and in the GI tract, called the microbiome. And that's the cumulative effect of the overuse of antibiotics, the inappropriate use of antibiotics added to the feed for livestock, and also changes in the nature of the food that we consume. I would say the U.S. has been the epicenter of that, but it's spread around the world, and clearly there are issues in South Africa as well.
Sure.
The more people get away from traditional ancestral diets towards a modern diet that is so excessively processed, the more likely this is to happen. And in some centers, in some populations, because this is such a new change and a sudden change, the impact may be greater over a short period of time than it is in places, let's say in Western Europe or the US, North America, where it's been happening gradually. Maybe there's been some process of adaptation.
Brilliant. I want to take a deeper dive into those three sort of interventions in the 20th century and the 21st century with regards to this escalation of allergies. But I know in your book in 2016, it was, I think in the last 50 years, you were saying 1 in 30 people used to suffer with allergies. Then it went down to 1 in 3. What has happened in the last 5 years? Because I mean, that's every 3 people, there's one person. What are the numbers, or what is the data? What does the research actually say now, 5 years later?
Okay, well, the trend continues up. Now, of course, in the past 18 months, the whole scientific world has been focused on the COVID-19 pandemic. It's not yet clear what the impact of this pandemic will be on the allergy pandemic. I'm concerned that it may make it worse, because what I've been seeing in a number of my patients after COVID is that there are people who are finding that they're much more part of the long COVID syndrome is an increase in allergy in certain populations. Also, with COVID, a lot of people were spending even more time indoors.
Yeah.
And eating even more processed foods.
Exactly. But let's start with the outdoor environment. Obviously, just my example is I suffer with hay fever. It's spring now, it's the beginning of 1st of September. But when I go down to the coast and I see my sister down in a city called Durban, the air's a lot more moist, I think. There's less pollution. I don't suffer at all with hay fever. How do people address this? Obviously, because of the automotive industry and, the regulations here in Africa are not as strict. So we've probably got a lot of pollution here in Johannesburg. What do people do with regards to this outdoor pollution? What is really, really important for them to immediately take action with?
Well, of course, what the medical establishment basically wants you to do is to take medication. That's why medication, the term medicine derives the concept of medicine derives from the use of chemical substances to treat disease. And so there are a lot of drugs like that. That's not what I'm, of course, recommending to my patients. In terms of natural products, actually, for seasonal hay fever, probiotics can be very helpful. But they don't work like drugs. They work slowly, so you have to start them a good 12 weeks before the allergy season, or just use them continuously year-round. And there are certain strains and species that have been shown to be really impactful on certain kinds of pollen allergies, strains of lactobacillus or bifidobacteria.
Okay.
Lactobacillus casei, and there are many varieties of these, probably has the best track record at helping people to diminish their symptoms of pollen allergy.
Okay.
Another treatment, depending on the type of pollen, might be honey.
Okay.
A study, and this was from Northern Europe, from Norway, a big issue in the Northern Hemisphere is cedar pollen. It's birch pollen. Cedar pollen's another one. And cedar pollen has been shown to respond well to a bifidobacterium probiotic, particular strain called Bifidobacterium longum 536. But for birch pollen, what the Norwegian researchers did is they had people consume birch pollen honey through the winter.
Wow.
And because of the impact of the digestive immune system on the systemic immune system, they were much less sensitive to the birch pollen the next spring and summer when that came about. So if there's a honey, if you know what the pollens are, if there's a honey that contains that, you might try that during the off season.
Wow.
Definitely the probiotics. And then there are foods that cross-react with pollens. Some of them are very specific. That is, birch pollen cross-reacts with foods through certain shared proteins. But some of them are very general. That is, there are these polyantigenic proteins that a lot of different plants have. So dietary alterations may make a difference, mostly altering the particular types of plants you're eating in season. So those are approaches for the hay fever type of problem. If you happen to get asthma from the pollen allergies, then there's very good research on the effects of fats and fatty acids. And I'm talking about the omega-3 fats that are found in fish oils and in certain seed oils from plants. Flaxseed, chia seed, example, have them. But fish oils are very helpful for preventing or mitigating the effects of pollen allergy. Again, these are not drugs. You don't take them because you're about to sneeze. You have to take it may take months before you notice an effect.
Yeah.
And the scientific studies with the fish oils showed that it takes a few weeks, and then you can measure changes in the laboratory. But the person might not feel anything for 3 months before. So the most important thing, if you're using natural approaches to treating your seasonal allergies or your environmental allergies, is to get a long running start. You have to change your body and its reactivity. This is not just suppressing symptoms.
Yeah, good. And I know you talk about
there are a couple of
talk about microbial diversity, more important as well. That's important. As a physician in my other life, doing functional medicine tests like GI mapping or the biome test or the omega-6 to omega-3 testing. I've done thousands of those omega-6 to omega-3 tests. I think probably 80% are sitting at a 25-to-1 ratio of 6-to-3 because of the process, foods that they're eating. And I've had one patient that's had a normal omega-6 to omega-3 ratio. How important is the testing? I think that's from a microbial diversity. Do you do a lot of GI mapping testing? Do you find it valuable? Or do you just look at the research and say, okay, well, we need this lactobacillus or we need this bifidobacteria? How do you address that from a testing point of view?
I do some tests. I do a fair amount of testing, actually. I'm a little limited by administrative law in New York State on what can be done. But I have a lot of patients. I have patients from all over the country. So I'm able to work in with different kinds of tests. And they're somewhat helpful, but at the end of the day, I don't follow any of the recommendations that any of these laboratories say this is what you should do. I personally would prefer it if all the labs did was give me the raw data and let me figure it out, rather than thinking they're going to figure it out for me, because they don't know the patient and I do know the patient. Those tests can be helpful. And certainly if you're in a situation where you don't have access to someone who really has expertise and an experience with this and who doesn't know the research literature, you may get some benefits from what the lab tells you to do, but they're pretty broad strokes. I would say that, so I spent a lot of time looking at the research literature and trying to understand how this lines up with the needs of my patients. Now, what I would say is the first step for me is the step of removal rather than let's add something. Because in so many cases, the reason that people have the allergic problems they have is because of the toxins in their environment, because of the medications they're taking or have been taking. There's so much digestive disturbances in the industrialized world. So, and there's so many people popping these acid suppressing drugs. That's about the worst thing you can do for your immune system, is to be popping
exactly.
Drugs like omeprazole and other drugs that are available for treating heartburn over the counter in the US and in much of the world. Those drugs are immune suppressive. You need the acid that they're suppressing. You don't get heartburn because you have too much acid. You don't get ulcers because you have too much acid. You get heartburn because there's a motility disturbance in the esophagus, and material from the stomach, mostly an enzyme called pepsin, refluxes up into the esophagus. You get ulcers most of the time because you either have an infection with a bacterium called H. pylori, or because you've been taking lots of drugs for pain, like ibuprofen. That's like 90% of the ulcers in the world are due to those two things, or drinking too much alcohol. So or smoking, so let's get those things that are making you sick out of your life. I mean, that's the first
removal.
And then the second, so that's the first step in the foundation. Second step is, let's get your diet healthy so that it's providing you with the nutrition that you need for your immune system to be well regulated. And that involves adequate amounts of protein, limiting sugar, a healthy balance of fats. That's the omega-3 versus omega-6 fats. And sometimes you do need some of the omega-6s, especially for asthmatics or people with eczema. And make sure that there's a really good level of polyphenols in your diet from plants, from herbs and spices and vegetables and fruits. You need the whole fruit. You need it should be fresh, preferably. And the same is true for vegetables. You can cook them. Cooking doesn't destroy most of the polyphenol activity. Or teas. And there's a reason why those things have been traditionally in diets. Let's put them back in and stop processing them out. And plenty of fiber. Because the combination of fiber and polyphenols shapes the nature of the microbes in your gut. I view the polyphenols as curators of the microbiome. They kind of determine, because of the way they interact with it, who grows and who doesn't grow. And so they're the sculptures.
You speak about Alexander the Great and Alexander's as well, which is an incredible. Why don't you give us the backstory on that and how important that is?
Well, okay, so that's something that I forget exactly when it was, but I was giving a talk about the microbiome, and it just popped into my head. The idea that having looked at the research literature and seeing what happens with patients, so just a quick background on the microbiome. We're talking about bacteria primarily, and there are about 100 trillion bacteria in your gut. Most of them in the large intestine, at least 1,000 species in each individual, many more strains. And they do a whole range of things. I mean, 95% maybe 99% of the chemicals that circulate in your blood originate with the microbiome. Your body may be modifying them, but you don't create them. The gut microbes create them. You have, this is a long, complicated, and fascinating story. I mean, human beings have very relatively few genes, considering how complex we seem to be. Maybe we're not as complex as we think we are, but there are 40,000 genes in a grain of rice and under 30,000 in a human being, maybe 25,000. So how do we manage? I mean, how do we manage to do that? Sure. Well, there are about 4 million genes that the microbes in our gut have. And so they really make up the difference. And they evolve with us. They are part of us. But we need to keep them out of the rest of our bodies. That is, they're a very dangerous set of collaborators in life. And so we keep them confined to the surfaces, including the inner surfaces, confined in the gut. There is a barrier function in the GI tract that is just as important as the digestive function. And that GI barrier keeps the microbes there, keeps them and a lot of their byproducts, which may be toxic, from getting into our blood and into our tissues. So paying attention to what happens in the GI tract really makes a difference. And I think that was a big turning point for me. The first turning point was realizing that a lot of the things I had been trained to do, and which I appeared to be very competent at doing, just didn't work that well.
Yeah.
There were a lot of people who weren't being helped by conventional medicine and still aren't. And it's amazing to me that the paradigm hasn't really shifted there. So I started looking into other factors, in particular nutrition. After working with nutrition for a few years, I realized that the gut was critical for determining what the impact of nutrition on the body was going to be. If your gut didn't function well, all sorts of nutritional supplementation, dietary changes just didn't really have an impact. So I started to really focus on helping people get their gut in good shape. And it's not just about bowel movements, that's part of it. Certainly things like gas and bloating, pain, constipation, diarrhea, they're all signs that something is wrong. But there's more beyond that. There are these many, there are these many functions of the gut microbiome that in which they interact directly with your immune system, with your brain, with your liver, and impact detoxification. So basically, I try to pull together what the available knowledge and information is to help people make decisions. There simply is no perfect stool test. There's no perfect probiotic. Each of us is unique. Each of us actually has a pretty unique microbiome. Yeah. And so I try to encourage people to understand their bodies, to be in tune with their bodies, know what impacts them. And at the end of the day, my role is as a teacher. Sure. To help people learn how to get themselves healthy and stay healthy. Good. In fact, probably the best experience in my practice occurs when someone I haven't seen in many years comes in to see me, either because they have a problem or they want a checkup. And I say, how have you been? And they said, well, I've been doing really well, but about, 3 or 4 years ago, I started to get sick. And I was going to call you, but I thought, well, what would Galland tell me to do? And so I did it and I got better. Then I know that I really succeeded.
Exactly. Because you're empowering patients to make the right choices through your teaching, and right. That's what the doctor is. as a teacher, not only as an interventionist. I do want to talk about allergy testing, how important you think that is, and maybe that can lead on to the power wash, because I think the power wash is really important. Some people do not have the means for all these testings. They don't have the finances and resources, but they can pick up your book, and the power wash is in there, and I think it's really practical, really important. I've used it with my patients as well, which I think has been really beneficial. But tell us about all this IG testing, and is it any value to anyone? And then the power wash.
Well, okay, so the IG, the antibody testing for allergic antibodies is of some value, but it misses a lot. First of all, most of what's available is testing for IgE allergies. That's the type 1 allergy that I talked about. If you are somebody who has very high levels of IgE, you're going to test positive to a lot of things. And that would be that's something that might be genetic, for example. There are a lot of false negatives with IgE testing for two reasons, actually. One is that some of the allergens in the food are very fragile. And so you'll react to them in fresh food or in freshly cooked food, or usually raw. But by the time an extract is made for a laboratory to use, that allergen is long gone.
Okay.
And that's been studied. People will react to a fresh extract with no preservatives of a fresh food in a way that they won't respond to the commercial extracts, let's say on skin testing. And the other reason why the IG testing is limited is that many of the allergic reactions that are important don't use IgE. They use another type of antibody called IgG, which there are 4 different subclasses of IgG. And sometimes it isn't even the IgG, it's not any specific subclass, it's the IgG binding. It just gets very complicated. And then there are some allergies that don't involve antibodies at all. These are so-called cell-mediated allergies. They're mostly looked for with patch testing, but the number of things that you can be patch tested to are limited, and the way your GI tract or your brain responds may not be the same way your skin responds. So at the end of the day, this testing can help to guide decisions. It's very imperfect. And that's why knowing what happens in your body to you is critical to understanding your allergies. And so I have 2 guides to that, actually, in the allergy solution. One is a questionnaire.
Yeah.
Before you even get to the power wash, asking kind of, which helps you, if you go through that questionnaire, it helps you decide what's the likelihood that I have an allergic reaction, and what are the kinds of things I might be allergic to, and then how can I test it out. Now, the power wash is a way to determine if you have food allergies. And the allergy solution was a book that I wrote with my son, Jonathan, and we worked out this approach, which was something that somebody could do kind of conveniently without taking 2 weeks off from work to do nothing but figure out whether they're allergic to food. So we set it up for a long weekend, 3 days of the power wash. And the power wash is a way that you do 2 things. Number one, you eliminate all of the most common allergens from your diet. But at the same time, you don't deprive yourself of nutrients. You actually, if you're following what would be a typical Western diet, you probably get more nutrients on the power wash than you would from eating fast food, as most people do in the US. But the idea was to help you start to fortify your immune system with the right nutrients, while at the same time eliminating all of the most likely food allergens. And basically it has 2 components. It has a shake, it has a smoothie, and a soup. And there's lots of vegetables, very nutritious vegetables in there. You do that for 3 days. to try and help you. If you are eating a food on a regular basis to which you're allergic, and you eliminate that food, you might go through a withdrawal. The withdrawal, it's like a drug withdrawal, and it can typically last for about 3 days. So the purpose of the power wash is to help people get through the withdrawal period. Occasionally, it takes a little bit longer than 3 days, but most of the time it's 3 days. That is followed by the testing phase. I mean, the power wash is not designed to be something you stay on for life.
Sure.
I mean, you could stay on it for much longer than 3 days and stay well nourished, but that's not the goal of the allergy solution. Is not to put you in food prison. It's to get you out of food prison. And give you as much freedom in your life as possible. So it's followed by something that we call reentry. And reentry is the introduction of healthy food in a systematic fashion in such a way that you can determine whether this food might make you sick. And just looking at the pattern of food allergy in general, if you're eating a food that you're allergic to on a daily basis and you withdraw from that food and then have it back, often at about 5 days after withdrawal, your body is really sensitive to that food. You put it back in and you can tell, yeah, this food is making me sick. Before, when you were eating it every day, there was a kind of accommodation. Yeah, you were feeling tired and achy, puffy, swollen, unwell. You didn't know if it was what you were eating. I mean, it didn't seem to matter what you were eating, but actually there were things you were eating every day. You take them out for 5 days and you put them back in and you feel like you've really been kicked. Then you can say, oh, that's the culprit. So we eliminate that. Now, for a lot of people, it's not just one food. I mean, it's multiple foods. And so the first 2 days of reentry, we designed so that it was foods that people were not likely to get sick from. So it basically kind of extends that period of avoidance to 5 days. And then you slowly work towards the foods that are more and more likely to be allergenic. Now, that may vary from continent to continent, for example. In North America, wheat, dairy, corn, and soy, those are the big ones.
Yeah, killers. I got 2 more questions and I want to just honor your time. But the first one is, spoken to Dr. Jeffrey Bland, who was on the show, Dr. Thomas Levy, the cardiologist, looking at how important inflammatory markers are. I wanted to get your perspective on that. If we look at things like HS-CRP, look at T3 to reverse T3 ratio being important, your liver enzyme test, oxidized LDL. How important are these inflammatory markers? I'm really there to empower and teach people to go to their doctors and speak to them about these inflammatory markers and how important them are. Are there any other tests, that you'd like to include there that people can really go and see? Well, if my HS-CRP is up, if my T3 to reverse T3 ratio is above 20, it's a problem. My liver enzymes are up. How important are these inflammatory markers, Dr. G?
Well, they're very important from the perspective of overall health, independently of the issues of allergies, although allergies to food in particular can be things that drive them up. Liver enzymes are not only important if they're out of range, how they change is important. I mean, there's studies showing that if your AST and ALT, which are 2 of the key enzymes, are typically in around 20, and then at some point they're in their 30s, or they're moving up towards 40, that change alone is significant for the health of your liver. That at least has been documented in women. And so it's really important to know about these liver enzymes because they reflect the stress on the liver. And CRP is a good marker of inflammation. Certainly if it's elevated, that's something that you want to be concerned about. Now that can go up and down. You get a cold, it may go up. So the timing of it is very important. There are other inflammatory markers as well. Some of those are not so easy to measure at the moment. But I definitely do think those are worthwhile knowing about. At the end of the day, it's the quality of your life and well-being that matters. And there's so many people who have just grown used to not feeling well that they consider that normal. So sometimes it's the people around you that can help you make that decision.
Yeah. Good. Last question. I know we got to head off, and thank you. Is changing your diet and changing your nutrition is a very simple thing, but it's probably the hardest thing for people to do. People say it's the lowest hanging fruit on a tree that people can grab, but I say to them, it is the lowest hanging fruit. It's really, really simple, but it's not easy at all. How do you motivate people from changing their nutrition and their eating habits? Because I think that's a game-changing piece of, lifestyle change. But it seems, I see patients, they're good for 6 months, maybe they're good for a year. They're back to their old ways, 12 months, 18 months down the road.
Right. So there are a couple of things there. First of all, one of the functions of the power wash is so that people can really understand and feel and experience how food is impacting them. Now, it is absolutely a normal human thing that once you're feeling pretty well, you kind of think, oh, I could, is to not learn from history. We see that in the world all the time. Yeah. Our species does not learn much from history. So it on an individual basis, it's pretty normal. Yeah, you're feeling pretty well. Maybe this is inconvenient. I'm gonna do this. I'm gonna go off a little bit. My buddy's doing that. And after 6 months or so, it doesn't kick you in the head the way it did after 5 days, because your body is in a much healthier place. But it will catch up with you after a while. The most important thing to do is just to be able to say, hey, okay, this is what happened. This is what I go through this with patients all the time. It's okay, let's just go back and let's just take a look at this. This is how you felt when you were doing the diet. And it lasted for a long time. And then you slowly started to deviate. Don't beat yourself up about that. That's because you're a human being. That's what people do. Learn to judge. You sort of become your own observer of how you are. Internalize that process of observation. You're the police. It's not me. I'm not the police. You are. You just recognize when you get to the point where you feel like, maybe I'm not doing so well. And if you can recognize that point before it happens, then that's the time to make an adjustment. Yeah. There's a teenage boy that I recently said, look, if you begin to feel as if, if this lasts for another few days, I'm going to call Galland. That's when I want you to take that step. Yeah. And if you can't take it on your own, call me then. Don't wait until you feel, I've got to call him. Do it beforehand. Yeah, see if you can check yourself then. Yeah. And at the end of the day, we're all adolescents, really, when it comes to how we handle food.
That's true. It's true. And one of the things that we've done at Made to Thrive is we've got health coaches to spend the time and try and walk a journey with people, because it's sometimes very difficult for people to do them on their own. Yeah. And obviously seeing the doctor is sometimes not a practical financial sort of avenue for them to follow. But I want to thank you, Dr. Galland. Incredible website, drgalland.com. There's a COVID guide that Dr. Galland keeps on updating, which is incredible. The allergy solution is, I believe, for every single practitioner out there that is treating patients. I think it's for every single health coach. I think it's an encyclopedia of understanding, or just getting an understanding that of allergies and how people can actually take accountability of this area and actually help treat themselves. We didn't get into Brussels sprouts and how important that is, Dr. Galland, but maybe another time, because I just think there's so much value to offer, and we're going to send you the snips and the clips and send you the video and the podcast. I just want to thank you for your, you're a man, I believe, who's committed to Western medicine, who's committed to natural medicine, who's committed to teaching. And I think those are powerful combinations, that it's not just a drug here, although I see with your COVID protocol, there's a lot of research, Western-based science that you're looking at, having a look at oxalic acid and these type of things, and curcumins and resveratrols. I've studied a lot of your work over the years, and I'm very grateful for that. So thank you so much, and I wish you well, and I really appreciate this.
Great. Well, thanks so much for having me on and for having this conversation.